International welcomes you to Community Health Volunteer Training Module 7, which covers health information management. And the objectives of this topic are: understand the concept, sources and uses of community health information, carry out household registration and mapping, participate in collection, collation, analysis, and dissemination of health information at community level, use of data for community health planning and action on identified pertinent issues. Lessons in Module 7, we have community health information and disease surveillance. Lesson 1, community health information. It will cover a few sections, which are introduction to community health information, number 2, village mapping, number 3, data collection and interpretation, and number 4, action planning. Section 1, introduction to community health information. What is community health information? This is information collected about the community that helps show problems, influence decisions, and show progress. Like village mapping, census data, service logs. Importance of community health information. This information helps the community to identify and understand and prioritize existing issues, come up with evidence-based solutions, plan for action, monitor and evaluate effectiveness, detects problems, like monitoring progress towards health goals and decision making, empowering individuals and communities with timely and understandable health-related information, provides proof for making rules and regulations, referred to as policies, shows success of activities that provide evidence for implementing similar activities elsewhere, can be used for research, for improving governance, mobilizing new resources, ensuring accountability in the way they are used. Section 2, village mapping. Steps to village mapping. First, draw a map of your village on the ground using chalk, charcoal, or sticks. Indicate households and social amenities, roads, churches, mosques, schools, water points, health facilities, marketplaces, and chief's camp. Identify symbols. This will use to mark various features. Transfer the map to your manila or flip chart. Importance of village mapping. It identifies social amenities, resources in the community, households. Village mapping uses. It locates various households for purpose of household registration, planning community actions, identifying features that can pose risks of diseases to the community: stagnant water, ponds, dams, waste fields. Section 3, data collection and interpretation. Introduction. Data collection is a systematic gathering of data for a particular purpose from various sources. It includes questionnaires, interviews, observation, existing records, and it's used for decision making. Collection methods. We have questionnaires, interviews, observation, existing records. Data for community health survey. Basic information on household members like age, sex, education, and marital status, household births and deaths records, health services and activities carried out by the community health volunteers and community. Data for community health survey, basic health status like pregnancy, antenatal clinic attendance, chronic illnesses, disability status, nutrition status, HIV testing, immunization status of children under 5 years, household health information management practices, water and hygiene, availability and use of bed nets, dish racks, presence of latrines, rubbish pits, leaky tins, family planning status of women of reproductive age, sources, household members, rumors, phone communication, social gatherings like weddings and funerals, chiefs barazas, schools, health records like antenatal clinics cards and immunization cards. Environment, asking and listening what people say about their health status. Observation, things that are important for the health of the community. Latrines and wells, are they safe? Are they utilized well? Do they need improvement? Taking count and recording. Check and count things or events. How many latrines are there? Cases of diarrhea per week. By use of registers and checklists. Taking measurements and weights. Using MUAC tapes and weighing scales. Tools for community health strategy. Referral form MOH 100. Household register MOH 513. Community health volunteers logbook MOH 514. Community health extension worker summary MOH 515 and chalkboard MOH 516 and ComCare. Tools for community health strategy referral form MOH 100. It analyzes data of patients and client and the reasons for referral, data of community health volunteers referring patients. Referral form MOH 100. It records data of patients and client, reasons for referral, data of community health volunteers referring patient. Household register MOH 513 determines overall health status in your community. The first reports of household register, which you will conduct immediately after this training, will serve as a baseline data for community strategy activities in your community. Household register MOH 513. The register is updated every 6 months. This is to know the changes that happen during the 6 months. It assesses success and challenges of your activities. After filling the register for all households, the completed forms are submitted to the Community Health Extension Worker. CHV will compile the data from all the community health volunteers, summarize to give the status of the households which they share with the community health volunteers, as well as the community health committee for further action. Household register MOH 513 data contained. Basic information on household members. Household health information management practices. Education status of household members. Household births and deaths records. Basic health status. Community health volunteers logbook MOH 514. Diary that the community health volunteers uses to record information from the household during their visit as they give messages and services. The basic information collected is accurate on what was done or identified in the household served. Community Health Volunteers Logbook MOH 514 measures the actual community health volunteers' effort, which should be written or filled during the household visit. It should be submitted to the CHV for summary every month by the end of the month. Community Health Extension Worker Summary MOH 515. This contains the summary data from MOH 514 used by the government and other stakeholders in decision making. Chalkboard MOH 516. It displays the general health status of the community unit, the basic community information that is updated every 6 months, health indicators that are reported monthly by community health volunteers for the year, used during the community dialogue days to discuss the action decided upon by the community. ComCare. It's an Android software that contains forms MOH 513 and MOH 514 owned by Village Hope International. Interpretation of community health information. The goal for collecting information is to assess the progress and to identify challenges with an effective solution. Summarize the collected data. Interpret the summarized data. Make the analyzed data presentable. Share the data with the community and stakeholders. Utilize the data and responses from the community effectively in action planning. Data interpretation. It involves examining data in ways that reveal the relationship, patterns, trends that can be found within it. Questions for interpreting data. What makes my community unique? What does the data mean for my community's health? How has my community changed lately? Does recent change affect the health of my community members? The work of community health volunteers? What are my community's major health concerns and challenges? Where are these challenges coming from? What are the gaps in our community health services activity, if any? Section 4, Action Planning. Introduction to action planning. This is a way to make sure your community's vision is made concrete. It describes the way your group will use its strategies to meet its objectives. Consists of a number of action steps or changes to be brought in the community. Components. Where do we want to go? Like the change we want to have. From where? Is it the baseline or our current situation? How we can know where we are. The way for measuring our change. How can we reach there? Actions to be taken for the change. Where do we want to go? Change we want to have. From where? Baseline or our current situation. How we can know where we are. The way for measuring our change. How can we reach there? Actions to be taken for the change. Who will take the action? By when do we expect the action to be done? What resources are needed to carry out our actions? Criteria to achieving a good action plan. Complete. List all the action steps or changes to be sought in all relevant parts of the community. Schools, business, government, faith community. Clear. It is apparent who will do what by when. Current. Does the action plan reflect the current work? Does it anticipate newly emerging opportunities and barriers?